Joining us now is former CDC acting director and current president and CEO of Robert Wood Johnson Foundation, Dr. Richard Besser. Good morning. Thanks for being with us.
Good morning. Thanks for having me on.
A lot of people complaining they want to get the vaccine and they can't, and then there's a whole other part of the population who says even if they could get it, they don't want it. How do you combat those two problems?
Yeah, they are both challenges. One of the things that concerns me is we have such a focus on how many people are being vaccinated each day. There's not been enough focus on whose arms are the vaccines going into and the importance of getting vaccines into those who are at greatest risk. And as I think about that, it's really thinking about who needs to leave their home every day to work, to put food on the table, to pay the rent, or to keep society going. And the advisory committee to CDC says after you've done healthcare workers and long-term care facility residents, nursing home residents, it should be essential workers. So police and fire, people working in the grocery store or driving the bus, the teachers who are in school, the staff who work in schools, those groups haven't been reached as much as they should be. And when you look at who has been hit the hardest by the pandemic, Black, Latino, Native American populations, those groups have been reached at a much lower rate than white populations just about everywhere across the country, and that needs to change.
There was a professor from Johns Hopkins who said because asymptomatic was so prevalent and testing was so low that perhaps we could reach herd immunity by April. That was a story in the Wall Street Journal, perhaps you saw it. What are your thoughts on that theory?
Well, I think that's probably overly optimistic. I am cautiously optimistic that by this summer, we're going to be able to have a summer that is much closer to a regular summer than last summer was. But we won't know when we've reached something like herd immunity, which is enough coverage with vaccine, enough people who've been infected that the virus can no longer spread in communities. We're not going to know that until we are actually there. And one of the things that will be a challenge to that is that viruses continue to mutate and change. And we don't know yet whether some of the variants that have cropped up in different parts of the country could continue to spread through communities that have already been hit by the strain that was spread in the United States. So in terms of my recommendations, we gotta, as much as we don't want to do it, we need to continue to wear our masks and keep apart and wash our hands and limit our travel and wait our turn so that when vaccines become available to each of us, we can get vaccinated and help protect our communities.
Real quickly, to double back to my first question there, what about the portion of the population that says, I'm skeptical of vaccines, I don't want to get it? And what will that effect have on herd immunity?
Yeah, well, thankfully, the majority of every racial and ethnic group wants to get vaccinated. In terms of addressing those concerns, it's a matter of ensuring people are hearing from trusted voices they trust. And for many communities, there's distrust of medical authority and governmental individuals. So reaching communities where they are and recognizing that someone who is hesitant today may want to get the vaccine tomorrow after they've talked to friends and family members who've been vaccinated. I think we're going to get there. The number of people wanting vaccines is going up, and that's very encouraging.
All right, Dr. Besser, we appreciate you joining us.
Thanks, Doctor.
Thank you very much.